It's my great pleasure to introduce Dr. Bruce Lee, and I had the opportunity to see Dr. Lee present some months ago and found his research really provocative and interesting, and I think you will as well. And Dr. Lee got his medical degree at Harvard University, and he's an associate professor and executive director at the Global Obesity Prevention Center at Johns Hopkins in the United States. He works in the areas of digital health, computation modeling, and system science. And in addition to over 200 publications, he's also an active contributor in the general media, including Time, The Guardian, and a regular contributor for Forbes in the areas of health, healthcare, nutrition, and physical activity. And I did ask Dr. Lee a fun fact, because I think it's always nice to know people a little bit better, and I said, what kind of fun fact could he tell us? And so Dr. Lee knows a lot of people who have been on reality TV shows, including classmates and friends, and this includes the very first Bachelor and The Real World, Survivor, American Ninja Warrior, and Eco Challenge. I was very surprised. I thought that's quite a feat to know all those people, and probably very interesting. And then also a friend who was on the game show Jeopardy, but not the person who just won all the money recently. So now on to Dr. Lee's presentation. Please join me in welcoming Dr. Lee to ISBNPA.
Thank you, Amy. I'm not sure if that means that I'm destined to be on a reality show. Hopefully not. So I'm going to be talking about how systems approaches can transform nutrition and physical activity. So I noticed on the first day that Bruce Lee was mentioned, and I'm not sure if it was actually referring to me, or rumor has it there's another Bruce Lee. And a Bruce Lee quote was mentioned during the talk. So I decided to offer some Bruce Lee quotes, and these are Bruce Wiley, so I have a middle initial Y to distinguish myself from other Bruce Lees that may have existed. So here are some quotes from me. Yes, I realize my name is Bruce Lee. 2 is, no, you are not the first person ever to point this out. 3 is, no, this is not a joke. I do not tend to joke while in the airport security line. No, I'm not his brother, because that would make absolutely no sense. And finally, there is a need for more systems approaches to address health and health-related issues. So to extend this analogy further, this is actually a complex systems problem, my name. So it was a simple decision. My parents said, oh, Bruce sounds like a nice name. And it has had complex results throughout my entire life. So every visit to the airport security line is quite an interesting experience. I had tremendous difficulty ordering US Open tickets when I was a kid, because many times they would say, look, we're sick and tired of these crank phone calls, get off the line. It actually allowed me to meet someone named Charles Norris. We did not fight though. And during a supply chain modeling project, this was actually in some of the remotest parts of Africa, I ran into people, and we were working with them to develop models of different types of health product supply chains. And I ran into people who didn't realize, the name of the President of the United States, and didn't realize, many other celebrities, but they had heard of Bruce Lee. And finally, of course, I was mentioned at the beginning of ISBNPA 2019, which I believe that's actually my name's actually my only asset. So there's been benefits as well. So let's start off with a question. So you've probably seen this in the news frequently. Does coffee help you live longer? So that often, periodically, like seemingly every month or so, you'll see a study that says, okay, coffee does this to life expectancy, or does this to the risk of heart disease, and sometimes it goes back and forth. So the answer is maybe, perchance, perhaps, conceivably. These are basically different synonyms of maybe that I found in the thesaurus. The last one, weather permitting, is not really applicable here. But the issue here is a lot of the studies that we see are correlation studies. They're associations, so they're large cohort studies. So this is a piece that I wrote in Forbes talking about 2 studies that were published in the Annals of Internal Medicine not too long ago, which showed correlations between coffee drinking and increased life expectancy. So, those are helpful to tease out what's going on, but the key thing we have to remember is coffee is part of a complex system. So when you think of coffee drinkers, you don't think of people drinking coffee in a closet, or by themselves. They're going to, instead they're going to a coffee shop, or they're interacting, and maybe they have enough social engagements to have opportunities to drink coffee. So these are things which can be in some ways controlled for in some of these large cohort studies, but not completely, because these are very complex systems. So as all of you probably know, correlations overlook complexity. So this is something that's frequently shown in the internet. I pulled this from the internet. But basically it shows the correlation between the number of pirates and the global average temperature. So this does not mean that if we want to address climate change and global warming, that we should somehow address the pirate issue. Of course, one of the challenges here is the number of pirates is approximate. I don't know of any studies which have actually quantified the number of pirates quite accurately. So these top-down approaches are very good in terms of discovery. They're very good in terms of identifying potential associations and giving us an entry point into saying, okay, let's dig deeper. But they do overlook complex systems. So as this shows, it's almost like you're hovering above data, or you're hovering above a situation, and you're looking down and you're looking for patterns. And I want to emphasize this is very important. This is very important research to be able to do this, because it helps us open the door and say, okay, we see an association, we see a correlation, and therefore we need to delve deeper to see what's going on. So in no way am I advocating not doing these top-down studies, because they're very important, especially when we don't really know what's going on. However, this raises the problem. This is the big problem when it comes to all kinds of areas of health, not just physical activity and nutrition, and the problem is Thanos. I don't know how many of you watched Avengers Endgame or some of those Avengers movies, but when you're talking about Thanos, he is the big bad character in each of those movies. Essentially what he did was he said, okay, we have a problem with overpopulation of the planet and the universe, so my solution is just get rid of half the people. That was his solution. So he snapped and got rid of half the people. But that was an overly simplistic solution, because ultimately, of course, getting rid of half the folks or half the living organisms in the world is going to create new problems as well. So I'm also frequently asked the question, what is the one thing to do to stop the obesity epidemic? My answer is stop asking that question, because it's too complex. So it's not going to be one magical diet. It's not going to be one magical exercise machine. It's not going to be one magical policy. It's going to be a combination of different policies. But just because it's complex doesn't mean we shouldn't tackle it. Because obesity is a systems problem. So this graphic essentially shows that, okay, well, you've got biology, you've got behavior, you've got social networks, you've got the environment, different aspects of policy, economics. They all are contributing to this global obesity epidemic. If it were just one thing, then we would either have solved it by now, or it would make no sense that everyone throughout the world would cooperate and agree that we're going to all change our behavior at once. So these are complex systems. So when I talk about complex systems, what do I mean? So all of you probably know that a system is a collection of parts and components that are not independent islands. They're actually interconnected, and they're highly interrelated. So each of us is a complex system. So we're walking around with complex biological systems. We have a complex set of behaviors, complex set of experiences. We all are embedded within complex systems. So we all have friends, peers, coworkers, acquaintances, et cetera, that we interact with. We're all part of complex environmental systems. So there's systems within systems. And there are many different complex systems throughout, so everything is a complex system. Here's some examples: transportation, meteorological systems, et cetera. The challenge is when we want to address problems that involve systems, which are basically almost every problem, every major problem, is if we don't treat these as complex systems, we run the risk of many problems happening. So one is Band-Aids rather than solutions. So this is very common in health and public health. So we come up with a Band-Aid, we cover up what we think is the problem. Essentially what it does is covers up the manifestation of a problem, and ultimately it's like pushing a balloon. So if you push a balloon one place, it's gonna pop up elsewhere. So these quote-unquote solutions are unsustainable. And many times you miss the secondary and tertiary effects, and quaternary, quintenary, and whatever comes after that. And these can either be positive or negative effects. So they can be negative effects in terms of unintended consequences. So there are many examples in health and public health where very well-meaning people came in and said, okay, let's try to fix a problem. They tried to fix the problem, and then there were unintended consequences. On the flip side, when you don't address this system as a system, you may miss some of the positive effects. So this is a challenge that public health faces all the time. Because as you know, whenever you have a positive public health intervention, it has many ramifications, and its value can continue throughout lifetimes, throughout many years, throughout many different systems. So when you don't actually address or encompass the entire system, you may be underestimating what you're doing. This is a huge continuing issue with nutrition and physical activity, because these are high-impact interventions, high-impact policies that have reverberating effects. So if you just measure what happens tomorrow or what just happens within a narrow scope, you're actually underselling what you're doing. So there's a real need for systems approaches. So why are systems so difficult to understand? Well, first of all, we're all people, so I'm assuming that everyone here is human. And regardless of how experienced or how much expertise we have, we can understand maybe first order effects. So if I push something, that thing's gonna move. But the secondary, tertiary effects, we really struggle to really understand that. So we basically need help doing this. And I've put these pictures of Finding Nemo and basically this explorer here for two reasons. One is to show that in order to understand the systems, it's complex, you don't know what might happen, you really have to search around. And two, last night at dinner, I was challenged to put these pictures in there, and hopefully I've successfully fulfilled that challenge. So I want to introduce or emphasize these bottoms-up approaches. So I talked about these top-down approaches where you look down, but the bottoms-up approaches is basically where you said, okay, what kind of systems are we dealing with? And let's try to recreate it. If you build the system, you actually you're forced to understand it. So for instance, if you're building a house, you're forced to understand what goes into the house. And the actual process of building the system, even if you don't completely understand the system, can be very helpful because you're building. So all of us have probably tried to build something, we looked at instructions, we tried to build it, and the instructions are difficult to follow, and then things get connected in the wrong way. At least that process helps us understand, okay, what really goes into building this vehicle or this house or this toy or what have you. So systems approaches are attempts to build a system. This graphic shows a systems approach and emphasizes the fact that it's iterative. And this is really taken from some of our work as part of the Spaces Consortium. So this is a USA consortium that's oriented towards bringing more systems approaches and methods to different USA programs and missions. So if we start here, if we look at the very top, so what's the first thing that you do? So say you're dealing with a system or a problem or an issue, and you want to figure out, what am I dealing with when it comes to the system? So the first step is to map out the system. So you say, okay, what are the different components? How are they connected? So you essentially try to draw the systems map. And these systems maps tend to cross areas, tend to cross sectors, tend to cross disciplines. So it's important to bring together all the stakeholders that are involved, and that tends to be multidisciplinary, to then create a systems map. This is saying, okay, this is our collective understanding of what's involved and how they're connected. So you can view the systems map almost like a skeleton or a framework, or the framework for a house, for instance. It just shows you, it's a static picture which shows you how things are connected. And these can be informed by different things like studies, narrative-based approaches, and other types of data collection. Okay, so that's helpful. But this systems map itself does not really show all the relationships and doesn't make those dynamics. So the next step is then you convert the systems map into a model. So I'm showing here a picture of, there's blueprints there, that's like the systems map, and then there's the actual spaceship. That's one of the Star Trek spaceships. And that actually has all of the processes embedded within. So you basically try to create mathematical relationships or computational relationships to create a simulation model that then simulates the system. All of these can do different types of things, like can elucidate important factors in relationships. So again, if you're forced to map things out, you have to say, okay, what's important here? What do I really need to know? And then if you build a model, you can test these different relationships and the impact of changing some assumptions. And then that tells you, what are the important factors in relationships. It can also help guide and prioritize data collection. So I remember one time I was in a UNICEF meeting, or a meeting at UNICEF that included folks from WHO, Gates Foundation, et cetera, and this had to do with vaccine distribution. And people were asked, okay, what data should be collected? And the answer was everything. So basically, they put together a whole list of like every important data, and that was just impossible to collect all that data. So a map and a model allow you the possibility of saying, okay, what are the high yield data? Where should we really prioritize data collection? You can use these to test different policies and interventions, like a virtual laboratory. You can then ultimately design and implement interventions and develop appropriate metrics and evaluation methods. Those things will generate information, which then you can come back and update the map and update the model as well. So it's this iterative process. This is very similar to what happens when we grow up. Like, so we're born. When we're born, we have a very primitive model in our heads. So we know to, like, I don't know, poop, pee, and eat, and things like that. So, but as we move along, as we gain more experience, so, you know, if you're a child and you walk around and you, like, run your head into the wall, you're like, okay, I'm not gonna do that again. So you're basically adding to your mental model saying, do not run into the wall head first. Or maybe you'll do that again, maybe you'll say that's a great experience. But either way, you're adding to your mental model. So when we talk about experience and instinct, we're actually running our mental models very quickly without realizing it. So you can do the same things when it comes to systems approaches. Many times I'm asked, well, what happens if you don't have enough data to build a map? What happens if you don't have enough data to build a model? Well, you always do. Like, you always have some conceptualization of what's going on. So the key is to get that on paper, get that in the computer, and then you can update it accordingly. So basically, what we're doing is trying to replicate the learning process. So let me give you some examples of how we've used some of these systems approaches. So this was a publication in the journal Obesity. And the question was, okay, what are the benefits of weight reduction? So say you have someone who's a 20-year-old and they're at a certain BMI category, and there's interest in potentially reducing weight, or you're a 30-year-old or 40-year-old or what have you. So there are some studies which have shown the impact of that, but a lot of those studies are short-term. They say, okay, well, you know, what's happened over, you know, a few months, or they're kind of large correlation studies and say, okay, a cohort, what happens in terms of disease risk and those type of things. So we were very interested in saying, okay, what happens if, you know, what will actually happen if you take a person and then over the course of his or her lifetime, what happens if that person either gains weight or loses weight? So we created a simulation model. So it's a simulation model of a person, and that person can occupy one of 16, at any given time, occupy one of 16 different states. So those states are a combination of different BMI levels as well as chronic health stages. So like, for instance, it can range from someone being perfectly healthy, quote unquote perfectly healthy, to having certain early signs of chronic disease, to later chronic disease, to very complicated chronic disease. And of course, one of the states is death. So basically, you have this simulated person, and this person progresses year by year through different health conditions, and then that person has probabilities of different types of clinical outcomes. Like, for instance, that person may have a heart attack, or that person may have develop a stroke, or things like that. And those risks are adjusted by what health state they're in. So if they're of higher BMI, if they have a certain chronic disease, they're more likely to have these things. So essentially, we create a simulated person that can go through life until he or she passes away. And then we can measure the outcomes. So I don't expect you to read every number in this table, but this essentially shows what happens when you have, on the left side, the starting age of the patient, and then they're in different categories, like they're in the obesity category, or the overweight category, or the normal weight category. And what's the difference in terms of things such as like third-party payer costs, productivity losses, societal costs, quality-adjusted life years. So this way, we could basically run the model and see what the difference is in terms of each of these different metrics. So we can say, for instance, you know, what's the incremental advantage or incremental change in terms of losing weight, in terms of their productivity losses over their lifetime and things like that, or year by year. So this way, we were able to quantify, you know, what's the impact of weight loss, and it was picked up by the media, and of course they said, okay, weight loss can save $30,000 or things like that. And this way, you're actually quantifying what might be going on. And that quantification can be helpful when it comes to determining the return on investment for different types of policies and interventions. So this is an example of really kind of capturing what's happening over the course of a person's lifetime. As another example, we've been creating these simulation models of different cities and different types of locations. So we've dubbed these simulation models VPOP for virtual population of obesity prevention. Has nothing to do with K-pop. And essentially, we've been creating these SimCities of different cities throughout the United States as well as in other countries. So these simulation models represent, in geospatially explicit terms, each of the different key locations within a city. So we'll identify where the different food sources are located, where the different households, different workplaces, schools, physical activity locations such as parks, gyms, recreation centers. And then we'll place them on this virtual map so that it's just like a real city. And then we'll populate the city with these virtual people. And these virtual people are just like real people. So we call them computational agents because this is an agent-based model. And we have a synthetic population of the entire United States, which recreates the entire United States. And each of these agents, just like a real person, has a different set of characteristics, like an age, a gender, a sex, a race, ethnicity, social economic status, a home assignment, a school assignment if they're in school, a work assignment if they're at work, and a height and a weight and different types of characteristics like that. So we'll get that data specific to that city. So we'll basically recreate a New Baltimore, or we'll create a new representation of New York City. Then each of these agents, these computational agents, so for instance, Baltimore might have over 1 million computational agents, just like a real person, has a daily schedule. So that person will wake up, make a decision about breakfast, whether to have breakfast, and if that person's gonna have breakfast, where? Should I do it at home? Should I do it on the way to school or at school? And then the agent will decide, okay, say the agent is a school-age child, that agent will say, okay, should I walk to school, or should I take a bus, or should I ride a car, or what have you? And that has implications. So if you're walking to school, you might run into different places along the way, and you're also burning calories along the way. And then while at school, that agent can decide whether to snack, whether to participate in different types of physical activity. So each agent has a daily schedule. And then each agent has an embedded biological model, a physiologic metabolic model, which essentially is going to take what comes into the agent, like food and beverages, and what goes out of the agent, like for instance, physical activity results in caloric expenditure, and converts that into changes in the agent's body. So we basically embedded a metabolic model that was originally developed by Kevin Hall at NIDDK, and then adapted that so that there are additions that represent what happens, in terms of different types of nutrition that goes into the body. And this can then translate to changes in terms of the BMI status as well as the chronic health status. So let me show you this visualization just to give you a quick sense of what we mean when we're talking about a simulated Baltimore. So this is a map of Baltimore. So we're zooming in and out. So as you can see, Baltimore is located in the East Coast between Philadelphia and Washington, D.C. And so here's a closer map where you essentially see these different locations that are mapped out on the map. So, and they each have different characteristics. Like that's a physical activity location. And there's different food sources that are mapped out as well. So in a moment, if the person clicks, you'll see these objects that represent people moving around. So they're moving around from their home locations, their workplace locations, or their school locations. Of course, we don't represent in these visualizations every single person because then it'd be covered with these circles. So essentially they're moving around and they're doing things throughout the day, like they're basically stopping by at different food sources and things like that. And then over time, we can track what might happen. So for instance, that's a food source where they might stop by. And each of these food sources have like inventories of where they stock either healthy or less healthy foods. And each of these physical activity locations have characteristics that then govern what type of physical activity they might participate in. So through this, over time, we can then track what might happen for each of these agents in terms of things such as BMI. So in a second, if this hand decides what it's going to do, okay, it's going to track BMI over time. So we can run this model over many years and then see what happens to the population. So again, these are the simulated populations and simulated cities. So let me give you some examples of how we've used this simulation model to address different types of questions and issues. So one big question is what to do about following physical activity throughout the population, especially among youth. That's a big issue. This is a story that I wrote in Forbes about physical activity levels dropping among kids in the United States. So one of the metrics, or one of the thresholds or recommendations, is from the SFIA, the Sports Fitness and Industry Association. So they recommend for youth, so kids, for instance, between 10 and 14 years old, that they should get a minimum of 20 minutes of moderate to vigorous physical activity 3 days a week. So if you think about it, if you think back to like when you were a child, that's really not too hard to do. So moderate to vigorous physical activity, so any type of physical activity where your heart rate goes up a bit. Turns out the percentage of youth in the United States that meet that threshold, that minimum threshold, is less than 30%. So you're talking about 29% of youth are actually getting at least 20 minutes of physical activity 3 times a week. So that's a big problem. So that's been a continuing issue. Many people are within the physical activity space are aware of it, and they have been trying to emphasize that this is a big problem. But the problem is, what's the potential impact of that? And the impact can stretch, in many different ways and over time as well. So in order to address this question or this issue, we developed a simulation model of all the youth in the United States, and then we wanted to determine, okay, what is the impact of this physical inactivity, and then what is the potential value or impact of increasing the percentage of youth that meet these minimal thresholds or these minimum recommendations. And this study was published in Health Affairs. And so essentially what we did is we created a simulation model of all the youth and vary their physical activity, and then we followed what happened with this cohort of youth throughout their lifetime. So we basically let them age until they eventually passed away. And then throughout the process, they would develop different types. They would change their BMI status as they aged, and they also would develop different types of chronic conditions. So this graph shows, okay, this is the percent achieving physical activity level. So this is both for the CDC minimum recommendations as well as the SFIA recommendations. So that lower active to a healthy level of physical activity, that's the SFIA definition. And the higher one, physical activity recommended by CDC, because that's actually a higher threshold, is higher on this graph. If you look at the x-axis, that's the percent achieving those minimum standards. As I mentioned, currently it's less than 30%. So if you increase it to 50%, 75%, 100%, what might happen? And then on the x-axis, you see the billions of dollars of savings. And then we've broken this down to medical care costs, lost productivity, and then total costs. So as you can see, just by increasing up to 50%, you're talking about somewhere between 10 and 40 billion of savings over the kids' lifetimes. This is for a given cohort. So in other words, if you take the current kids in that age group, increase their physical activity level, you'll ultimately realize those billion-dollar savings. So this cohort replaces. So once those kids age out of those cohort, you have a new cohort. So this is a recurring billion-dollar savings in these different costs. So over time, you can see how that can accumulate quite significantly. So these are some of the other numbers of what happens if you increase the physical activity levels of kids to 50% of 50% of youth meet the CDC level. These are the billions of dollars saved for direct medical costs, productivity losses, life years saved. This is what happens if you go up to 100%. So see, these are some of the different types of metrics. So again, this is a recurring savings for each cohort that basically ages into that group. And then we ran a variety of different sensitivity analyses and say, okay, what happens if we change the mode of physical activity? As you can imagine, slow walking is a little different from bicycling, which is different from running. And this shows the changes in terms of billions of dollars of savings. So when the numbers that we previously showed we're sort of like in the middle in terms of the types of activity. So if you actually get people even more vigorous physical activity, you actually have greater savings. So the numbers were then picked up by a number of different media outlets, and also they've been used subsequently by many different types of decision makers. So every time people say, okay, what is the impact of getting kids' physical activity levels up? Here are the potential savings. So this was used by some of the effort, like the Partnership for Healthy America, as well as the Project Play, which I'm going to describe in just a second. So Project Play is actually a consortium of different organizations that are very interested in physical activity. So this includes some of the major sports leagues, in fact, all of the major sports leagues, almost all of them, as well as sports equipment manufacturers and and so we're actually founding partners of this Project Play 2020. And the goal of this consortium is to set goals for every 3 years to find ways to increase physical activity level among children. So set metrics and then find ways to try to encourage these increases. And so we've used the numbers in many cases to basically demonstrate to decision makers, this is the impact of kids not being physically active, and these are the potential savings and the potential value of different types of interventions. So for example, there's been focus areas like, for instance, in Western New York, in Detroit, Southeast Michigan, the greater Rochester area, where we generate numbers that were very specific to those locations. And then they were implementing different types of physical activity interventions, like finding ways to increase the number of coaches in the area, or finding ways to build different types of physical activity locations like parks and recreation areas and things like that. Also establishing these sports leagues. And with each of these cases, we've used these numbers to then show the potential economic value of doing this, which has helped different types of constituents get on board with these different types of activities. So a second example of how we've used these simulation models is looking at the impact of crime on physical activity and ultimately obesity and different types of chronic diseases. So if you think about crime, many times it falls in another sector, or it falls within another discipline or another area versus like physical activity or nutrition, et cetera. But they're really actually quite connected. So the people studying crime don't always interact with the people who are studying physical activity and nutrition. And we said, well, okay, there might be a connection there, and how, what is the potential connection? So this was published in the journal Obesity. And the first thing we did was we created a model of different districts or wards, specifically wards 5, 7, and 8 in Washington, D.C. And then we mapped out the different physical activity locations, as well as we took crime reports and mapped out the density of crime that occurred in these different wards. And then we ran the simulation model where we looked at what the population would do over time. So the density map for crime essentially represented this terrain. So the more crime there was, the tougher it was for people to actually get through that area. So think of it as almost like this tougher terrain or this gel. If there's a lot of crime, you tend to avoid going through a particular area. So this then determined the paths that people took throughout the day and the likelihood of them going to a park or going to a gym based on the level of crime. So for instance, if I live in a location and there is a park like across the street, or maybe there's a gym 6 blocks away, but that will require me to go through high crime areas, or maybe even the park is a very high crime area, then I'm a lot less likely to actually use that area for physical activity. So we simulated those different things. So for instance, whenever someone is deciding whether to exercise, he or she goes through different types of decision making. So we represented within each computational agent the decisions that they would make, like, okay, should I exercise? If I exercise at home, okay, well then that's not going to be affected by crime. If I decide that, oh, I'm going to go to the gym, well, where's the path to the gym? Should I walk through that path? What should I do? So this is a simplification, these diagrams, but we basically represent all the decision making when it comes to physical activity. And then we ran the simulation model, and we found that, not surprisingly, if you increase the level of crime in different areas, physical activity went down, and then ultimately that affect obesity and overweight levels over time. So we ran a variety of different simulation experiments to see, okay, what's the impact of reducing crime in different areas. This basically just shows the different levels of crime and the percent of accessible physical activity locations, and then what happens to baseline probability of exercise, and then we translated those things to changes in obesity and overweight prevalence. So as a third example, we used some of our simulation models to look at the impact or the value of sugar-sweetened beverage warning labels. So you may know that in 2015, the city of San Francisco passed an ordinance that promoted the use of sugar-sweetened beverage warning labels in different retail locations. So these would be labels that say, okay, drinking, the consumption of sugar-sweetened beverage label, sugar-sweetened beverages, is tied to the risk of obesity, the risk of different types of chronic diseases. Of course, that ordinance was fought quite staunchly by different folks in the industry, but the ordinance passed, but has been challenged. And there's been subsequent interest in different municipalities in repeating the ordinance. So for instance, in Baltimore, the city council started debating, what should we do in terms of this SSB warning labels? Is this something that we should adopt? So we were working with them fairly closely, and they asked us if we could simulate the impact of SSB warning labels in Baltimore. So we basically created models of 3 cities, Baltimore, San Francisco, and Philadelphia, and then we looked at different types of scenarios in which these warning labels were placed in different locations. So maybe at grocery stores or corner stores. And we also varied the type of label that was placed. So it ranged from labels that were all text, so all text, for instance, in English, versus all visual graphics. And of course, you can imagine some labels that are all text in English might be less comprehensible by someone who may not be able to read English, either based on literacy or if they come from a different language origin. So we try to determine, what's the value of this and quantify that value. So then we placed these different sugar-sweetened beverage warning labels, ran this simulation where, the individuals would go into different stores and locations, and if they saw the warning label, that might change their probability of getting an SSB. So here are some of the results. So you can see on the x-axis, we vary the efficacy of these warning labels. So what happens if it has no effect? What happens if it's 4%, has 4% efficacy in terms of changing that decision, 8%, 12%. There was some studies that were conducted in Baltimore by Sarah Blyce and her team, which showed that the baseline efficacy, or based on their findings, there was an 8% change in terms of people's purchasing. So if you have 100 people, 8 of the 100 people would change their purchasing behaviors based on the warning label. So we use that as baseline, but we varied that efficacy to see the impact of that. So on the y-axis is decrease in obesity prevalence over time. So decrease in obesity prevalence, and x-axis again is the efficacy of the warning label. And each of these different clusters are for the different cities, so Baltimore, Philadelphia, San Francisco. So in all cases, if you had a warning label that was at least 4% efficacious in changing that decision, you would ultimately see decreases in obesity prevalence, holding everything else equal. And these changes also varied by city. So you can see, so each of these things represent, the median and then the range in terms of what we saw with the simulations. And you can see it's highest in San Francisco, in the middle in Philadelphia, and lowest in Baltimore. So this represents the fact that when we're talking about cities, we're talking about very heterogeneous systems. So the impact of an intervention in one city is not going to be the same as in another city. So in this case, we showed it's all going to be positive, but it may vary because each of these cities vary in terms of their obesity and overweight prevalence, their distribution of population. They vary in terms of where the different food sources are located, beverage sources located, and their stocking patterns. So the model represented this heterogeneity and actually showed the heterogeneity in terms of results. And then we also did sensitivity analyses where we varied the things such as the label efficacy, the literacy rate, the corner store compliance, all these different types of things. So when you have this virtual laboratory, you can test changing all the different substances. You can test changing the different types of variables. And I want to emphasize that this is, when you're trying to study complex systems, it's more important to really understand the relationships. It's more important to understand what happens if I change different things. These aren't crystal balls where it says, okay, we'll run a simulation and this is exactly what will happen in 10 years, or this is exactly what will happen in 20 years. That's forecasting to an unreasonably exact way because you know it's not going to happen. But what you can tell from these systems models is what's the relationship, what are the key drivers, and what happens if you change some of these key drivers. So with all this, I want to emphasize that we are at a key inflection point. In the past, maybe 20, 30 years ago, we didn't know as much about these complex systems. We didn't have access to a lot of this data that's available now. We didn't have access to a lot of the computational power that we have now. And so if you look at some of the big trends or some of the buzzwords, I love these buzzwords. I like to go to cocktail parties and just speak in nothing but buzzwords. But basically, if you look at these buzzwords like wearables or mobile devices or big data or AI and all these different types of things, all these trends actually connect with better ways, potentially better ways to understand these systems. So now we have a lot more data and we have big data. But if we use the same approaches and the same traditional approaches when analyzing big data, all we're doing is we're taking data that's a lot greater in terms of volume, a lot lower in terms of value, a lot higher in terms of velocity, in terms of all this data that's coming at you, but we're not really harnessing the full effect or the full potential impact of this big data. So this big data will be very valuable when it can help inform building some of these systems models or some of the systems mapping. Because again, if you analyze big data in very traditional methods, you're just kind of taking messier data and you may potentially get messier conclusions. So the same thing with all these different types of trends. They all connect with potential systems methods and really can go far in terms of helping us understand these systems. And times are changing. So if you look back 10 years ago, or maybe even 7 years ago, there wasn't as full an understanding of systems approaches and methods, but we're seeing a greater interest in this. So I'm pointing out three things here. So one is the NCI recently had a systems epidemiology workshop that's focused on cancer. So how do we bring more systems approaches to the epidemiology research in cancer? And then this thing on the right, and I think some of my colleagues from this committee are in the audience as well, but this was a National Academies committee that was convened to review the Dietary Guidelines of America process. So the process by which the Dietary Guidelines of America are put together every 5 years. Review that process and make recommendations on how that process should be changed. So our committee met for I think about a year and came up with different recommendations. And one of those recommendations was to bring more system science approaches to putting together these recommendations. So again, finding ways to understand the systems that connect what you put into your mouth with ultimately what happens to your health and then what happens to chronic disease outcomes. And really understanding how all those different other factors play roles. And then that will help us better understand the connection between diet and ultimately the outcomes of interest. And finally, this is something that I wrote about on the bottom left, multi-scale modeling. So there's this initiative called IMAG that's a collection of all the federal agencies, so NASA, FDA, NIH, CDC, et cetera, that's come together to form something called IMAG, which is the Intra-Agency Modeling Analysis Group. And one of the things they've been pushing is how to develop more multi-scale models. So these are computer models that really span different scales, so biological scale, behavioral scale, population scale, and try to bring together these systems and these connections. Because if you think about it, many disciplines will study one specific aspect of the system. Like, I'm going to study the cells, or I'm going to study the organs, or I'm going to study what happens with behavior. But all of these things are connected. So we have to find some way of connecting these complex systems, and multi-scale modeling is one of the things that can do that. So with that, I'd like to summarize some of the things that I mentioned. So everything involves complex systems. If we ignore these systems, we're essentially ignoring everything. And overlooking systems has its consequences. So I mentioned unintended consequences, secondary and tertiary effects, potentially wasting time, resources, and effort, to coming up with solutions that ultimately aren't effective. And these complex systems can be quite difficult to understand and address without help. So we need help. So as humans, we have our limitations. And that's where systems methods like mapping and modeling can help. And again, I want to emphasize these are iterative processes. And these are not there to replace clinical trials or cohort studies or all these other great techniques that are out there. They're there to enhance them. They're there to bring them together and actually enhance their usefulness. So as I showed in that diagram a number of slides ago, those things fit into building the maps, into building the models, and the models and maps can help inform the design of those different types of studies. So they all fits together. And also, we're in a new era for systems approaches. So we have the opportunity, we have a lot more data, we have a lot more techniques to use, and we have a lot more potential applications. And finally, I want to emphasize, give more thought into choosing your name for your kid, because it's going to have complex effects throughout that person's lifetime. So with that, I wanted to give credit to our system science core. So these are the folks that help put together our models. I want to point out some particular people. Marie Ferguson, she's been very instrumental in terms of moving forward a lot of these models. I will also emphasize Cheryl Siegman, who's the Director of Operations for our center. She's been very important in organizing these projects, and Marie Spiker, which has been leading our agricultural and food systems work. And then here is our center. So here are members of our center. Joel Gibbelson leads our community interventions work. Tim Moran leads our biological and behavioral work. Brian Schwartz does a lot of work in the environment and the impact of the environment on food and nutrition and obesity. So with that, thank you for your time, and be happy to entertain questions.
ISBNPA does have a present for you.
Oh, thank you.
You're welcome. And before we move on to Q&A, I just want to go through some housekeeping announcements again for those who came in late. Actually, I misspoke before. Actually, tonight's dinner is sold out. And again, make sure to bring your name badge and event ticket with you. And then also the meeting point for the shuttles pickup and drop off will be in the front of the Congress Center. And shuttles will go to the monastery and will leave from 19 hours and run until 20 hours every 15 minutes. And then shuttles back from the monastery will start at 21 hours and run until 23:40 every 20 minutes. And then there is an ISBNPA members meeting that will be held today in South Hall 2A during the lunch hour at 1:30. And then mentoring, meet the professor lunch will be held today at 1:30 in Terrace 2A and Terrace 2B. And it's not too late to sign up, and sign-up sheets are at the message board next to the registration desk. And with that, we're going to move on to the questions and answers. And again, I really enjoyed this. Thank you very much. And for a little bit of a different change, we have a gift for those who ask a question to Dr. Lee. And the gift is an ISBNPA t-shirt for 2021 in Omaha. But I do encourage you also to be attending ISBNPA 2020 in Auckland, New Zealand next June. And I also want to thank Dr. Esterbrooks, who helped in designing and purchasing the t-shirts, but he couldn't be here. And so I have my colleague, Eric Calloway, who's going to try his, we don't have one of those, like, guns that shoot out the shirts. So instead, he's going to do a football throw. And we'll see how good and if you have the wrong size, you could come up and get the right size after. So with that, let's start with some questions.
So the first question is, if I ask myself a question, do I get a t-shirt?
Yes.
Okay. microphone?
If you could go to the microphone, please.
The mic switched on.
Hi, my name is Annette Alberg, and I teach at Touro University, California, in Vallejo, California. And one of my concerns is the input into these models, which I think are so exciting. I'm working in a low-income, ethnically diverse community with high school students right now, and I looked to see who was part of your team, and I realized that information in has a lot to do with who's represented and what their understandings, and I'm learning so much from these young people that's so new and isn't it reported in the literature about their concerns, their barriers, their hopes, and what's up for them. And so that's one thing I wanted to ask you, and how much effort is going into looking at new qualitative research that might be coming out and quantitative research to help inform what we think should go into the models and what we might be missing.
Yeah, good question. So one of the first steps, as I mentioned when building these models, is a systems mapping exercise. And many times these exercises are done best if you bring in representative stakeholders who are involved in the systems that you're trying to represent. So for instance, if you want to build a model of a town, you might want to get decision makers in the town, but you also might want to get community leaders or people who are representative of different groups that are within the town. And you pull together people in a room and you say, okay, let's try to sketch out what's going on here. That exercise alone can be very informative. So you bring together different people and what you'll see is each person will have their perspective of what's going on. So rarely will you get one person who knows everything that's going on. You don't have that present person who says, okay, I know everything about the system. And then that actual process is interesting. So you'll say, okay, let's go to a whiteboard and let's sketch this out and say, okay, what are the key things that are going to affect an issue that we're interested in? So, for instance, if we're interested in finding the roots of the obesity issue that's going on in our town, what do we think are affecting that? So people say, okay, well, here's the food sources, here's the physical activity locations. And someone might point out, well, like whenever I try to drink water, I can't find a water fountain, or I can't find some place to even buy bottled water, so I end up drinking soda. And people may not be aware of that. They say, okay, well, we have to take into account where the water fountains are. So different things like that. And rarely do those occur without new insights. Rarely do those occur where you say, oh, we didn't think about that, or we didn't consider that. And then there's a discussion about, okay, how do we get information on that? So the process of systems mapping itself can be very useful. So we talk about like participatory group mapping or participatory group model building, where you actually go through that and try to get everyone engaged. And it's very important to facilitate this in a way that you get everyone to speak up, because whenever you put together these groups, there tends to be maybe one or two or three dominant voices that will say, okay, this is how it's going to be. So if you want to be a facilitator for that, it's really important to be able to find a way of like getting everyone's opinion and making this in many ways a safe zone, because you might have situations where there are conflicting opinions. So part of that emceeing, essentially being a master of ceremonies, in that situation is being delicate and trying to bring some of those things out. Does that address your question?
Yeah, so I'm not sure this will yet. So my question is related to that, but it's really sort of very simple. And how accurate are your simulation models? And second question, does it matter?
Yes. Excellent question. I'm going to try to give you a vague and inaccurate answer. No, I'll give you a very rather specific answer. So validation is a big part of model building and model running. So there are several steps in validation. So one, the easiest and most important step, first step is face validity. So you show the model or the structure of the model to people who are affected by it or in the know, et cetera, and they say, okay, are we representing, does this look like we're representing what we're supposed to represent? If something doesn't pass face validity, you're game over, you have to go back. But once it passes face validity, Then there's different steps. So you can go through criterion validation, where you see if the model can reproduce or generate results or measures that match those of historical data, or maybe concurrently collected data or prospective data, and say, okay, can we reproduce, for instance, the obesity rates over time? Does the model do this? It's really important when you do validation to not just validate the end measures or end results, but all the different levels in the model. So for instance, when we were looking at the sugar-sweetened beverage warning label issue, not only did we look at, are we recreating obesity rates? Are we recreating chronic disease rates? We also looked at, are we recreating the actual movements of the kids to the different stores? So for instance, there was data that's been generated by BHCK, which is an ongoing study that's led by Joel Gittleson, who's faculty at our GOPC and Johns Hopkins University, and that showed, okay, those are surveys of where kids tended to go in terms of getting their sugar-sweetened beverages. So things like that. So you want to validate at different levels to try to make sure the model is trying to reproduce what it's actually trying to reproduce. Now the question is, how exact do you need to be? Well, it depends on the question. And we have to have an understanding. Sometimes these models may not be exactly accurate, but they help us, if they can help us generate an understanding of what are the key drivers, or generate an understanding of the relationships involved, or actually raise other questions that are important, then they've served their purpose. So I think the short answer is, yes, you want to try to represent what you're aiming to represent, but that's getting something precisely accurate is not the goal. One of my, Phil Cooley, who's a longtime modeler, who's one of my friends and colleagues, likes to say that these models are not scalpels, they're sledgehammers. So if you want to get the very precise answer, like it's 2.1678, then you're actually asking for too much.
Sure.
Does that answer your question?
One more question.
Okay.
Thank you for an excellent presentation. Do you have an example where you actually predicted something to happen, and did this then really happen in reality by the authorities following your advice or something like that?
Yeah, we've done this type of modeling in many different areas, not just nutrition and physical activity. We've done it in the control of healthcare-associated infections in terms of vaccine distribution, and looking at flu preparedness and those things. So in each of those different areas, we do have examples of where we would run the models and generate results, inform decision making, and the decision making would occur, and then the results actually matched, in some cases, roughly what we had predicted. So, so I could, in the interest of time, I can't go through all of those examples, but one example I can give is during the 2009 influenza pandemic, we were embedded in the Department of Health, the U.S. Department of Health and Human Services, and we were working within HHS along with the CDC and Homeland Security to use modeling to help inform the national response. So there are all these questions that emerged throughout the pandemic, like, should we close schools, or should we, who should get the vaccines first, or what should we do with antiviral medications? So one big question was, should we close schools? Should we say, okay, schools should be closed a certain period of time until the pandemic passes, or there's less of a risk? And of course, because kids are the super spreaders, kids go around and they smear themselves with everything, and they smear other people, and so they very readily can spread the virus. So school closure is one of the big considerations when it comes to epidemics. So we ran our simulation models, and we found that actually if you close schools, things could actually get worse. So this is an example of an unintended consequence. So you could actually make the epidemic worse by closing schools for a period of time. So the question is, why is that happening? Well, based on our models, we found that if you close schools, then basically the kids stay at home, and some of them actually may mix in the community. And then if you reopen schools, you're essentially taking a bunch of kids that have been isolated, so they haven't been exposed to the virus, and then you're pushing them back into schools, and if the virus is still around, it will spread like wildfire. So it's actually better if people kind of progressively get infected, rather than just releasing a bunch of susceptible kids back into the middle of the epidemic. So we found it actually got worse, so this helped inform it provided further evidence that, okay, closing schools may be not a good idea. We also found it to be very costly. After the pandemic, there was data from around the world, and in certain places, like in parts of Japan, I believe in some parts of Eastern Europe, they had actually closed the schools, and they found an uptick in the flu activity as a result. So that's an example of the findings matching what we predicted with the model.
Thank you.
Again, thank you all for coming, and I'm sure Dr. Lee wouldn't mind taking a few more questions after. So thanks again, Dr. Lee, for a great presentation.